Hi there. I want to spend the next couple of minutes discussing an important topic. We often hear of the violent acts occurring to nurses through the news, our close friends, and countless other sources. But do we know the definition of workplace violence? The National Institute for Occupational Safety and Health defines workplace violence as violent acts, including physical assaults and threats of assaults, directed towards persons at work or on duty. Workplace violence is a problem all over the world. The first documentation of workplace violence dates back to 1824, and ever since, workplace violence has increased to be the prevalent topic it is today. The Bureau of Labor and Statistics states that registered nurses account for 46% of all non-fatal assaults and violent acts related to workplace violence requiring days away from work. Along with lost work days, departmental budgets are also affected by decreased productivity, decreased retention, and increased turnover of medical and psychological care for employees, and workers' compensation. The hospital also bears the costs related to decreased patient satisfaction, increased litigation, and changes in hospital reputation. Therefore, not only are nurses the ones who are affected by workplace violence, but the overall healthcare business is impacted as well. From conducting a literature review, I have found that there are some common themes found in emergency departments where workplace violence is very common. Studies conducted by Rick Brown cite the common factors are the availability of drugs and money at hospitals, unrestricted movement of the public in clinics and hospitals, long waits in emergency departments, and delays to transfer patients with mental health difficulties to appropriate settings. Other common factors linked to workplace violence are the belief that violence is considered part of the job, and the lack of reporting by staff. According to the 2011 study by the Emergency Nurse Association, 54.5% out of 6,504 emergency nurses experienced physical violence and/or verbal abuse from a patient and visitor during the past week. The actual rate of incidences of violence is much higher, as many incidences go underreported, due in part to the perception that assaults are part of the job. This belief that violence is part of the job is one of the many reasons it's hard for researchers to accurately track how often nurses and other healthcare providers are being attacked. For my literature review, I have found that there are three common themes that add to workplace violence. The first, nurses underreporting. The second, culture of the unit. And the third, lack of consequences for violent behaviors. Let's focus on nurses underreporting. There are a number of reasons as to why nurses don't report. Some nurses have no physical bruise, so they believe it's not reportable. Some nurses find the reporting protocol to be inconvenient or time-consuming. Some nurses may have a fear of retaliation. Fear of retaliation from a unit manager, from a patient or visitor causing the patient hospital satisfaction score to go down, fear of retaliation from hospital administration, from fellow nurses, or from physicians. Some nurses state, no one reports, nothing will be done. The belief that even if I report, nothing will be done. Some nurses have the idea that violence comes with the job. Let's focus on number 2, culture of the unit. Some nurses state, why report? What is it going to solve? Other nurses may say, what do I get from reporting? What's in it for me? Some units may have unclear reporting policies, and other units may lack the definition of workplace violence, making it hard to report. Let's move on to number 3. Lack of consequences for violent behaviors. The Emergency Nurse Association states that out of 50 states, it is only a felony to attack a healthcare provider in 31. Even though it's a felony in 31 states, workplace violence is a complex topic and a lot of work is still needed to be done to protect our nurses. So who is more likely to suffer from workplace violence? Studies show females between the ages of 26 and 64 years old are more likely to experience workplace violence than others. Studies also show that new nurses could be new grad nurses or nurses new to the ED setting are more prone to experience workplace violence than others. Where does the ENA stand regarding workplace violence? The ENA is constantly changing and updating their materials for nurses on this prevalent topic. They currently have 6 position statements regarding workplace violence, but I wanted to provide you with 2 titles that you could use to gather more research on workplace violence. The first one, the ENA position statements on violence in the emergency care setting, and the second one, Mitigating Violence in the Workplace, written by the ENA and the American Organization of Nurse Executives, Guiding Principles. Other helpful sources that could be found on the Emergency Nurse Association website is a toolkit and an online module. So what does the research say about ways we can prevent these attacks on nurses and other healthcare providers? To help change the current culture that exists amongst nurses in terms of reporting violence, leaders need to support staff members in the challenging everyday work that they do. In addition, leaders must also ensure that mechanisms are in place to respond when violence that is unexpected or intolerable occurs. Leaders should have a zero-tolerance policy towards violence on their units. Leaders should also have a definition of workplace violence in place so that nurses and other healthcare providers know the difference between violent behaviors and nonviolent behaviors, allowing nurses to appropriately document and/or report the incident. The Emergency Nurse Association believes emergency nurses have the right to education and training related to recognition, management, and mitigation of workplace violence. Now that I have inundated you with all that information, why does it matter? With the increase in violence amongst nurses over the years, nurses are more prone to taking time off from their professions. This could eventually guide them to dissatisfaction with their job, leading them to burnout, eventually causing them to leave the profession altogether. The biggest challenge is to ensure that violence against healthcare professionals does not come with the job and ceases to be considered part of the job. So I'm asking you as a nurse to 1. Know the definition of workplace violence. 2. Create a culture in your unit that encourages nurses to report the violence. And 3. Report it. Like we learned in nursing school, if you don't document it, it didn't happen. Thanks for watching.